The unprecedented spike in infections during the second wave of the COVID-19 pandemic in India has finally started to subside. Interestingly, this downward trend has actually been witnessed with increased vigor in Uttar Pradesh, India's most populous state. Let's look more closely at this situation to understand how a responsive and proactive leadership enabled the administration to control the spread of infections. The active cases that had risen to over 3 lakh have declined sharply to just over 1.2 lakhs and are still falling. That's less than 40% of what they were at the peak. The recovery rate across the state has skyrocketed to 91.8%, which is one of the highest in the country. Moreover, the state took one of the shortest time span to ramp up its daily tests to over 3 lakhs a day. What's more, the positivity rate for COVID-19 tests has actually fallen to as low as 2.45%, meaning that less than 3 people test positive amongst 100. Can that not be called a remarkable achievement? As of May 19, over 4.58 crore tests have been done for COVID-19 in Uttar Pradesh, with close to 3 lakh tests done on this day alone. On another front, vaccinations have been done on war footing. So far, over 1.5 crore people have been vaccinated, with just under 33 lakh having received both doses. Similarly, aided by an effective drive to minimize delivery times and ramp up production, the supply of oxygen in the state has been increased to 900 to 1,000 metric tons. By creating regional hubs, oxygen has been supplied efficiently to hospitals across the state. As per latest figures, there are close to 74,559 beds across different state and private hospitals, including over 17,500 ICU beds. Not to mention how the ingenious drive to make rural areas and smaller units like individual wards free from coronavirus infections has been doing exceptionally well. These achievements by the Chief Minister Yogi Adityanath-led government, coupled with the aggressive testing campaign based on the test, track, treat approach advocated by Prime Minister Modi, have earned it praise not just from national bodies like Niti Aayog, but also the World Health Organization. A highlight has been the model adopted to combat COVID-19 in Varanasi. The 24/7 command center in the city has 20 dedicated phone lines manned round the clock. In addition to a DRDO COVID hospital, 2 oxygen plants, several hundred cylinders and concentrators have been ordered and deployed. This again is another addition to the existing facilities, like oxygen plants already functional in the district. While the RT-PCR testing in Varanasi has more than doubled to 12,000 tests daily, the positivity rate has fallen from a high of 37.1% on May 1 to just 2.55% on May 19. Similarly, the daily cases that stood at 2,702 on April 23 have fallen to just 244 on May 19. Moreover, following Prime Minister Modi's appeal to stop the transmission of COVID-19 at any cost and following the aggressive testing campaigns in rural areas, the distress calls from Varanasi's rural hinterland alone that stood at 800 a day have reduced to just 100 a day. The administration too has trained healthcare staff from primary and secondary dispensaries in COVID-related protocols. Furthermore, 70,000 medical kits have also been distributed in the district's rural areas. Given the pragmatic and dedicated approach, this new healthcare model emerging from Uttar Pradesh has showcased remarkable success. Going forward, a similar approach aimed at safeguarding vulnerable communities in rural areas while simultaneously ensuring best possible healthcare for patients can become potent weapons in India's fight against the pandemic.